Oh, shut up. Shower, suit, slap. Oh, give me a break. Hi, Mum. Thanks, I need it. I don't feel very bona fide at the moment. Nothing. Mum, I don't need a lecture. Yeah, look, you're making me late. I've got to go. Bye.
As long as Stacey got her card all right. Anyway, I'm giving her money but didn't want to put it in the card, so just to say I could bring it with me later if... run out.
Sarah?
Hey, go. Oh, excellent.
Everything okay?
He loves it.
Sorry?
Mashed banana and porridge. Before you know it, it'll be on steak tartare.
No, I meant...
Oh, you look terrible. Daddy needs a shower. He does not smell gorgeous like you.
Smelling gorgeous won't last.
Yes, Mummy will be at work by the time that happens.
I'll make you breakfast.
Thanks. It's all right, darling. It's all right. On second thoughts, I'll skip breakfast.
You can't do that, it's not good for you.
I don't need a mother, Daniel. Are you going to be a lovely boy for your daddy? Are you? Bye-bye, darling.
That hill will be the death of me.
Over the hill, eh?
You really shouldn't attempt jokes. What are you doing here, anyway?
Repeat prescription for my blood pressure.
Oh, is that all?
Noticed anything different?
If you've had Botox, you've been robbed.
Not me, him. Harry Potter.
Do you think he's even qualified?
They wouldn't let him work here if he wasn't.
I don't know what the health service is coming to. Schoolboy chemists, incompetent doctors.
What time's your appointment with the new one?
9:20.
I'm in at 10 past.
They told me I had the first available appointment.
After mine. Of course, Karen's particularly fond of me. I said to her once, it's a tonic seeing your happy, smiling face. And she said, Bella, it's seeing you that does it. If only all patients were so lovely.
You've got a vivid imagination.
Mrs. Hewlett?
Yes. Thank you. Getting there first won't do you any good.
Can't believe they put Rob through to the second round of Super Share.
Shame he got disqualified, though.
Oh no, it was worth it to see the look on Mrs. Tenby's face. Hi, I'm Karen.
Jazz.
Nurse Marquez and Dr. Clay.
Yeah, we already met.
Yeah.
Actually, I'm due at the police station, so you can use my room today if you want.
That's brilliant. Thanks.
Catch you tomorrow.
Do you fancy coffee?
No, she does not have the time. Mrs. Hollins, would you mind looking after the reception desk?
Hang on, I'm not wearing this for a bet.
Dr. Carter has asked me to conduct a tour of the surgery. It will not take long. Dr. Kehela?
Ugh, snooty or what?
I mean, throwing her orders around since when? Was she senior to me?
I wasn't talking about Mrs. Tenby.
Oh, I'm going to throttle that woman.
Hi, Karen.
Morning, Mill Health Centre. Oh, hello, Mr. Banerjee. What can I do for you?
Stop waving like an imbecile and come and sit down.
Dr. Carter's got an appointment this afternoon. Yeah, this afternoon.
Should have said it if she hadn't been so busy. People like that see hundreds of patients. She barely knows who you are. How about her? There was a time when women dressed like that were only found walking the streets.
Elegance is a thing of the past.
Absolutely. Mind you, grooming was always second nature to me.
And me.
But I was a professional model.
There's more to being an air stewardess than sitting around posing. We were rushed off our feet, but always had to look fresh as a daisy.
Your daisy days are well and truly over.
Speak for yourself.
I've never seen her here before.
I'm glad I don't have to do that anymore.
Child minding was such a huge commitment. 2 days a week I could have spent with darling Stuart.
Only 2 days. I had Stacey for 5.
You're forgetting. My grandchildren were twins. Twice the commitment.
So, you had the rest of the week off. My life wasn't my own. At least I can please myself now.
Indeed. We both can.
Morning, ladies. Early birds, eh?
Dr. Tyler always has a pleasant word.
I find him rather belligerent. He gave me very short shrift the other week.
Probably because you were wasting his time.
Pot, kettle, black.
I just think there are times when you need to remove the barrier.
The desk.
I meant more the sense of hierarchy. Mrs. Tenbay doesn't approve.
Call me old-fashioned.
Aha, fresh meat.
Dr. Tyler.
Kevin!
Yo!
Hey, you know each other.
Yeah, from medical school. What are you doing here?
Oh, it's great to see you too.
Is it? You need to go back to your desk.
I beg your pardon?
Before Karen blows the gasket, it's crazy out there.
Well, thank you, Dr. Tyler. The tour has ended anyway. Dr. Kahila?
And you have a couple of regulars waiting. Old dears with nothing better to do.
Kevin?
Bella and Christine. Ah, yeah, see, we've all been there. Enjoy!
All right, I'm coming.
I imagine they'll have a marquee in the garden.
Must be a big garden.
Oh, yes. Colin's done very well for himself. He's inherited my get-up and go. No expense spared for Stacey.
Lucky girl.
I've got a picture. Of course, that's when she was my little girl. They grow up too soon.
Oh, lovely. Anyway, you'll be tripping the light fantastic later on.
Pardon?
At the party. Your blood pressure's spot on.
Not even slightly high.
Why do you think it could be high?
Now and again, I have a bit of a whizzy head.
You suffer from dizziness?
No, whizzy's not the same as dizzy. You know, when someone says their head's spinning?
Yes.
Well, it's not like that. I can't really describe it.
Okay, so does this whizziness occur at any particular time of the day?
No.
Or when you've got up too quickly?
No.
I wouldn't worry, Bella. You're as healthy as a woman half your age.
I see. I'm sorry to have wasted your time, Doctor.
You haven't? Hey, Kevin! Do you still see anybody from uni?
No one you'd know.
What about Tintin McLaren?
Well, hardly. He's in a Buddhist retreat in Tibet. Jacked it all in.
No way.
Yeah, I reckon it's something to do with him losing his hair.
Excuse me. Am I interrupting a conversation of great import?
You must be Mrs. Tickle.
Tickell.
Sorry. Please, go in, take a seat.
Thank you.
It really is great to see you, Kevin.
So he keeps saying.
How can I help?
I have a hitherto undiagnosed heart condition. You are my last vain hope.
Can you describe your symptoms?
Perfectly. Just lately, I've been getting a fluttering sensation
Whereabouts?
In my throat. It feels as if my heart has flown there and got trapped. I've looked it up on the internet.
Can I just stop you there, Mrs. Tickell? You need to be very cautious about self-diagnosing on the internet.
If your doctors were any good, I wouldn't need to.
Do you experience any pain or breathlessness?
A little pain. Not that I'm one to complain. But the breathlessness seems to be becoming more frequent. I had the devil's own job getting up Columbine Hill this morning.
May I feel your pulse? Okay, if you can slip your coat off, I'll have a listen to your heart.
Thank you. I know the drill.
Okay, I'll see you later.
Thank you. Bye.
Hello, Bella.
You could have said that before in front of her.
Well, I didn't see you there. Anyway, how are you?
The doctor says I've got the body of a woman half my age. I'm an evolutionary miracle.
Oh, did she say that?
Well, that's what she meant.
So does this mean we're not going to see so much of you nowadays?
I've still got my whizzy head.
Karen,
Sorry.
I'd like you to run an ECG on Christine Tickell.
The thing is, it's usually clear.
Could you just do it, please?
Where's Christine?
I'm afraid I can't discuss that with you. She'll be through soon, don't worry.
Hi.
Whatever it is, you're going to have to be quick.
Look, I was hoping we could talk.
Daniel, I'm expecting a patient any second. What's the matter? What's wrong with Joe?
Nothing, Sarah. Look, please.
Put the phone by his ear.
Hello, darling. It's Mummy here.
Are you having a lovely day?
He says yes, thank you.
He sounds bored, and that's because you are.
I can hear it in your voice. Why don't you read to him or something?
Look, I've got to go. Give me a call back at lunchtime.
Yeah, bye. Okay. You know what? I think it's time for a lie down. Come on. Yeah. In you go. Now be a good boy for Daddy, okay? No crying. No crying. No. Ah! Okay. Right, here we go again.
Thanks, Karen.
Pleasure.
So, what's the verdict? Go home, put your feet up, have a cup of tea.
Actually, your heartbeat is faster than normal.
I knew it!
Yes. In my opinion, it's a condition known as supraventricular tachycardia, known as SVT.
Let me write that down. Supraventricular...
I'll refer you to a cardiologist
specialist.
and prescribe some beta blockers.
A referral and a prescription. I feel as if all my Christmases have come at once.
Really?
A diagnosis. At last.
Don't be too hard on the other doctors. Heart rate irregularities can be unpredictable and not always picked up by an ECG.
Modest as well as brilliant. Thank you so much, Doctor. You've got a prescription. And a referral. The head cardiologist at St. Phil's.
Let me see that.
Ah, Dr. Carter. Are you responsible for recruiting Dr. Keller?
Is there a problem?
Quite the reverse. She is a talent with a capital T.
Well, she was my first choice.
Actually, she was mine.
What would you know? You're just a pen pusher who ticks boxes. Come along, Bella. We have an appointment with Harry Potter.
Yep.
Christine Tickell's ECG result.
You're winding me up.
No. What do you think?
Well, given her age and other factors, probable SVT. Why are you asking me?
You're a more experienced colleague.
Ah, pull the other one. You didn't need my help at medical school. You're hardly going to be asking me now.
You should be flattered.
And why would you want to flatter me?
I don't. Your head's big enough as it is.
That's more like it.
Thanks for your help, Dr. Tyler.
kiss from Stacey? Thanks for card, Nana. And a kiss.
Duty done.
I'm sorry, we're out of stock.
Out of stock? We're talking about life-saving tablets, not frozen peas. I assume you know the difference.
I'll order them in by special delivery.
This wouldn't have happened if Kenneth were here.
If you could come back at 4...
4? I might have dropped dead by then.
In my opinion, that's unlikely.
You haven't lived long enough to have an opinion.
You could try another chemist.
You're not getting off that lightly. I'll be back at 4 and they'd better be ready. Come on. Let's go back to mine and have a drink.
No! I've got to go and get ready for the party, in case I get a phone call.
Pigs might fly.
Well, sorry if it's taken so long to get around to you.
I've had a busy morning myself.
Well, you seem to have made a very positive impression on one of our more challenging regulars.
Elderly patients get anxious about their health, often with good reason. It's just a question of checking that everything's okay and offering reassurance where needed.
I think you're going to be an asset to the team.
Good. I'm glad.
And so to the form filling. Essential, I'm afraid.
I've no problem with paperwork. Keeps everything in good order.
I'm glad you see it that way. Not many of your colleagues would agree.
Serious? Well, the doctor's being rather coy. This coming weekend? Are you sure you can spare the time, darling? My daughter's coming up from Salisbury.
Nice for you.
Oh, that would be wonderful. I'll see you then, darling. And don't worry. There's life in the old girl yet. I've tried to play it down, but she's beside herself. It makes such a difference having a caring family.
My Colin cares about me.
He's a funny way of showing it.
It's not him, it's her, my daughter-in-law.
If he were any sort of man, he'd stick up for you.
Don't you dare badmouth my son.
It's no use shouting at me. I'm not the one neglecting you.
Right, I've had enough.
Oh, don't let's fall out. Have another sherry.
Stuff your sherry. I've got a life, even if you haven't.
Hey, Kevin.
We've really got to stop meeting like this. Where's your lunch?
Oh, I had a big breakfast. So, where are you living?
Leatherbridge.
No, I meant in a flat or in a house.
House.
Great. So, do you have the place to yourself, or are you sharing with anyone? Girlfriend, maybe?
Let's cut to the chase. You're after my body, right?
As if.
My sandwich, then? Go on, then. On the condition, you tell me what's really going on.
Okay. I've had some personal problems which have left me, well, homeless, really.
And you haven't got round to getting a place?
I just wondered if you could help me out.
Sure, yeah. There you go. Property pages.
I meant, could I keep on your sofa?
Whoa, newsflash, you're not a student anymore.
I know, but I can't afford a flat.
Well, I've managed.
You were one of the lucky ones with a full-time job.
Ooh, jealous.com/jazz.
I'm up to my eyeballs in debt, and my part-time salary's not going to cover it, but hey, I'll be fine.
The first rung of the ladder. Your very own property.
Yep. Shame penthouses are so scarce in Leatherbridge.
Do not be deterred. Your dream home is waiting for you out there. Mrs. Hewlett, you know that the surgery does not open until 4 o'clock.
That's what it is, outrageous.
What's the matter?
Christine Tickle gets preferential treatment. You don't do anything about my whizzy head. I could have a brain tumour.
Mrs. Hewlett, have you been drinking?
That's her fault, celebrating her heart condition, preening herself because her daughter rings her up. My son thinks just as much of me. If I was at death's door, he'd be beside himself, he would.
Let's talk about this inside.
I have places to see and people to be.
Bella, please, be careful.
I'd like my medication, please. Christine Tickell, 26 Ashburton Grove. Wave your magic wand, did you, Harry?
I think you'll find everything's in order.
It had better be.
Hello.
Hi. You didn't ring as promised.
Yeah, sorry, been busy.
Doing what?
Well, you know, just a day in the life of a house husband.
My heart bleeds for you.
Is that Joe crying? He seems far away.
Yeah, look at you. Yeah, I've had a bit of a day of it with him, actually. I think maybe he's cutting a tooth.
Really? You should try taking his mind off it.
I don't believe you can take a baby's mind off pain.
Are you okay, Daniel?
Yeah, fine. We both are.
In that case, could you
Whip up some supper tonight. I don't feel like cooking.
Yeah, sure, no problem. When you're back, use your time.
Yeah, bye.
Yeah.
Colin, I'm sick of leaving messages. Oh, you're there. Hallelujah. No, I'm not angry at all. I'm just wondering what time I should come over. Colin? Why is it awkward? I need to give my granddaughter her birthday money. A cheque? Did Valerie put you up to this? I bet she's sitting there listening. Well, I hope she can hear me. I hope she can hear me when I say I'm not begging for the crumbs from her table.
You're welcome.
Thanks, bye.
Bye.
I see. Thank you. Sorry to have troubled you.
Oh, Doctor, thank goodness. I think Harry Potter's drug dealing.
Sorry?
The chemist is adamant that you collected your medication.
Nonsense. It's some kind of scam.
He said that Mrs. Tickell came in at 4 o'clock, that she was for drink.
It couldn't have been me. One of my grandsons rang me at 4. Such a lovely boy and really anxious about my heart condition. Not everyone can claim to have such a caring family.
Mrs. Tembe, could you phone Bella Hewlett? Tell her I'm on my way.
Bella? I'm the one that's ill. This is outrageous. Simply outrageous.
Can you look?
No reply.
Keep trying. You might be able to help me out here, Christine.
What?
Please.
Colin, is that you? Too late.
Bella?
Can't.
Bella, it's Dr. Can you hear me?
Dr. Colin Rowe.
This is Dr. Keller from the Mill Health Centre. Can you send an ambulance to 54 Windermere Road? 67-year-old woman with reduced consciousness, shortness of breath, possible overdose.
Is he coming?
Okay, Bella. Try to stay calm.
May I go with her in the ambulance?
Yes, of course.
Colin's coming, dear. Christine, before it's too late, I want you to know you're my best friend. We've argued, but we've always been close, haven't we? Say you'll forgive me.
Bella, you're not dying.
Aren't I? Oh, thank goodness. I've been so stupid.
She'll want to take it all back now.
I don't.
Why don't you two try and turn things round together? Interesting women should be leading interesting lives. We'll talk about it when Bella's better.
Sorry, I stole your tablets.
Blame it on my sherry, dear friend. Speaking of which, have you ever been to Jerez de la Frontera?
Any news of Bella?
Yeah, the hospital rang. They're keeping her in overnight, but she seems to be doing okay.
Good, pretty impressive for your first day. See you later.
Yes, well done, but remember, one swallow doesn't make a summer.
I won't let it go to my head.
Good answer.
Have a lovely evening.
Sour grapes.
Any more pearls of wisdom to impart?
No. I admire how you've taken charge of today, especially as you're going through it.
Sympathy? You?
So, you can have the spare room if you want it.
Really? Are you sure?
Just for a few nights until you get yourself sorted. Deal?
Deal. Joe? What's the matter? Daniel? Oh, when did you last change him? It's all right, darling. It's all right. Oh, dear. It can be our little secret. Kevin Tyler, are you blushing?
I've never blushed in my life.
In fact, he's a very special case.
Firstly, I'm not a case. And secondly, I just want to be treated normally.
Well, you know that's never been possible.
Big deal. Get over it. I have.
Have you? How would I know? I mean, shout at me, scream, do something!
A new start at a new